We have a very exciting program for you today, and the fog has cleared, so maybe the fog of this issue will clear a little bit too this morning, we hope. I'm Elaine Chapnick, president of the local summit. This morning, because we have three speakers, all of whom have, or each of whom has a lot to say, we're not going to go around and introduce ourselves this morning. Suffice it to say that we have representatives in this group from all three municipalities and from many, many of the nonprofits that do such a good job of serving this community. I think, Jeff, you had a few words to say with tidbits. You wanted to have a...
In deference to our meeting today, there will be no tidbit. I know. Oh, before I forget it,
right.
Wasn't it a wonderful event for Bob Hyden?
Yes.
So next meeting, next month is our last until September.
Well, no, we do have a June meeting.
We do meet? Okay.
Yeah.
Well, we're getting towards the end of the semester, right. So I think there'll be an exam next month.
Okay.
So be ready.
Okay, great. Thanks so much. And now I'm going to turn the program over to Malcolm.
I don't think I need this. Good morning. For those of you who don't know me, I'm Malcolm Froman. I'm on the board of the local summit. As many of you know, the open door proposal to put a school-based health center in the Mamaroneck Avenue School has gotten a lot of coverage and stirred some controversy. And the board thought it would be a service to the community to step back and take a broader view of what some of the health issues in our communities are. When our committee, which was comprised of me and Ann Bedkowski, Janet Buckbinder, and Shirley Hilton, started looking into this subject, my reaction was, are we going to be able to cover such an important and broad topic in an hour over bagels and coffee? So we may be staying here through lunch. I didn't tell you that. But short of that, it may be that this session will be the first of what may be a series of presentations on the subject of community health. When I first started researching this several months ago, I had the opportunity and privilege to meet and talk with quite a few impressive, well-informed, and smart people, including and especially the three people who are on our panel this morning. And I'd like to introduce them to you now. Lisa Perry joined the Community Healthcare Association of New York State in 2008 as the first director of the Primary Care Health Information Consortium to support New York City health centers in adoption and use of health information technology. She is now the association's Senior Vice President for Quality, Technology, and Initiatives. You want me to use that? Okay. Since 2013, Lisa has overseen the organization's entire statewide health IT and clinical quality improvement program, which supports over 60 New York State federally qualified health centers. Lisa has over 20 years experience in New York healthcare with positions at New York University, New York Medical Center, Bellevue Hospital Center, and the New York City Health and Hospitals Corporation, public hospital system. She received her MBA from the Stern School of Business at New York University and her Master's of Public Policy with a concentration in health policy and management from the John F. Kennedy School of Government at Harvard University. Lisa and her family are residents of Larchmont. Laura Rossi is a senior program officer at the Westchester Community Foundation, a philanthropic institution that supports a vision for a county with improved quality of life, vibrancy, community health, and natural resources protection. She has developed initiatives at the foundation focusing on environmental sustainability and smart growth, affordable housing, better health through partnerships with the faith community, and expanded access to fresh, locally grown food in underserved communities. In July 2015, she will become the executive director of the foundation.
Congratulations.
She is a board member of Sustainable Westchester, a consortium of local municipalities that facilitates sustainable principles, and a board member of Support Center Partnership and Philanthropy, a management support organization that partners with philanthropic institutions excuse me, to help nonprofits become more effective in accomplishing their mission. A lifelong Westchester resident, Laura received a bachelor's degree in philosophy from St. John's College in Santa Fe, New Mexico, and her JD from New York Law School. As Senior Director of Healthy Living for the Rye YMCA, Laura Tiedge provides strategic direction and management of all member and community wellness initiatives and programs that focus on improving and maintaining healthy outcomes. During her tenure at the Y, she has led the launch of 4 chronic disease programs, including the Y's Diabetes Prevention Program, Live Strong at the YMCA, Enhanced Fitness, and the Health Smart Behavior Program. In 2011, Laura started a women's triathlon team to help beginners find a focused approach in leading a healthier lifestyle and attain personal goals, for which she received the Y's Excellence in Innovation Award. Laura chairs the Portchester Cares Healthier Portchester Committee and the Mamaroneck Cares Healthier Mamaroneck Committee. Laura has a BA in Social Science from SUNY Stony Brook, and an MS in Organizational Management and Leadership from Springfield College. Laura moved with her family from Pittsburgh, Pennsylvania to Westchester County in 2001. Now, our committee tried to get 3 presenters all named Laura, but the best we could do was 2 Lauras and a Lisa. Lisa will start off by presenting some interesting statistics about our district, along with some other information. Then Laura Rossi will talk about local health issues from the perspective of her foundation. And finally, Laura Tiedge, we've come to refer to her as Laura T as opposed to Laura R, will be discussing some of the Rye Y's initiatives and what we can do as a community and as individuals to promote better health in our community. So, Lisa.
Thank you, Malcolm.
Yes.
Thanks, Malcolm. Can everybody hear me? Yeah? Okay, great. So I'm going to talk a little bit about our district, just a few some sort of snapshot statistics that are interesting. Then I'm going to talk about the federally qualified health centers in New York State, what they are, who we serve, what services we offer, and then just give you like 2 seconds on the organization that I work for and how we relate to the federally qualified health centers. So while our district does enjoy relatively high health status, we have some very interesting social disparities. We do have 2 zips, and there are some very interesting differences in the socioeconomic and health status indicators between those 2 zips. When you look at census data from 2010, which was the last census, and when you look at New York State health data, the most recent data that I was able to find on zips covers the 2010 to 2012 period. So for example, when you compare 10538 to 10543, the residents of 10543 are 3 times as likely to be uninsured, twice as likely to have limited English, 4 times as likely to lack a high school diploma, and twice as likely to live in a household under $15,000 income annually. Just a few sample sort of health status indicators. Again, comparing the 2 zips, in 10543, women are twice as likely to have had late or no prenatal care. Children are 3 times as likely to visit an emergency department for asthma-related illnesses. Teens are more than 10 times as likely to become pregnant, and residents are 6 times as likely to have Medicaid or no insurance. So just a snapshot on disparities in our own community as a backdrop to the intro to what is a federally qualified community health center. So the federally qualified community health center is a specific type of community health center. Community health center is a generic term for any community-based primary care providing organization. The federally qualified health centers, of which Open Door is one, which is how I ended up here. This program was introduced in 1965, so it's a 50-year-old program. It was originally part of the War on Poverty. The objective was to expand access to high-quality, effective primary care in neighborhoods, and federally qualified health centers are now the largest primary care network in the country. They do receive relatively small federal grants to help cover care to the uninsured, and they must serve an underserved area or population, offer a sliding fee scale, provide comprehensive services, have ongoing quality assurance, and a governing board of directors. They're all nonprofits. They function like any other nonprofit with a governing body and bylaws, and the difference is that they're subject to a rather extensive set of federal and state regulations. There are 4 types of federally qualified health centers. There's the general community health center. We also have in different parts of the state health centers that serve migrant populations. We do a lot of mobile work. We'll take vans out to migrant camps, as well as vans out to schools and anywhere where there's a shortage of care providers. So we have migrant health centers. We have health centers that specialize in care to the homeless. And we have health centers that are located in public housing developments. As I mentioned, federally qualified health centers are required to provide a very broad array of services, including primary health care for adults and children, dental care, behavioral health, and prescriptions. Many have pharmacies on site, but not all. In addition, what differentiates the federally qualified health center from many other primary care providers is the requirement that we provide enabling services. And enabling services are things like translation, transportation, health education, and other services that facilitate the access to care for populations that otherwise may have difficulty accessing care. There are 5 characteristics which really distinguish a federally qualified health center from what you may think of as a free clinic. They are required to serve high-need areas. They are required to provide comprehensive health care and related services. They are open to all, regardless of insurance status or ability to pay, must offer a sliding fee scale, and do bill insurances. So these are self-sustaining nonprofits. They do bill Medicare, Medicaid, commercial. I go to a federally qualified health center. A lot of people with insurance use federally qualified health centers. A lot of people in our state live in areas where there are no other primary care providers. North Country, Adirondacks, Central New York, Southern Tier. If you think of, we're kind of in a little bubble here. We're in a very unusual part of the state. But we also have many underserved communities. In addition, they're governed by a community board. 51% of the board must actually be patients of the health center. This really came out of the War on Poverty movement to empower local communities and to engage patients in their own health care. And they are subject to 19 program requirements from the federal government, which cover everything from services to management, finance, governance, you name it. And they are monitored annually for their adherence to those 19 program requirements. So we're very proud of our health centers. As I mentioned, they are celebrating 50 years. The 50th anniversary of the federally qualified health center movement is this year. Nationwide, there are 1,300 federally qualified health centers with 9,000 sites. serving 25 million people. They have received many awards and recognitions from the Institute of Medicine, the Federal Office of Management and Budget, the Federal General Accounting Office, recognizing their effectiveness in reducing healthcare disparities and their cost-effective quality care. In addition, it's a very interesting program because it has historically enjoyed bipartisan support in Congress, which is, as we know, a very rare thing. In fact, George Bush Sr. was very instrumental in the expansion of the program in his home state of Texas. So it truly has been a bipartisan supported program for over 50 years. In New York State, we have 63 federally qualified health centers all over the state, although because we are a sort of bottom-heavy state, half of them are in New York City. They operate 600 sites all over the state, and we serve close to 2 million patients. School-based health centers are part of the first type of health center, the generic community health center. There are 2,000 of them nationwide, over 200 of them in New York State. They are not all associated with federally qualified health centers because New York State also funds school-based health centers. There are over 200,000 students enrolled in school-based health centers in New York State. Services are provided on-site at the school. The school district decides the scope of services that they would like delivered in the school. They are staffed by a nurse practitioner or a physician assistant under the supervision of an MD or a DO, doctor of osteopathy. And they have been shown to support improved health, attendance, and student performance, and that really is the primary reason for the genesis of the idea to locate healthcare within a school. Parents have to enroll their students, so everything is with parental consent. If you do not enroll your child will not be seen in the school-based health center. And they can basically provide any care that you would receive in a pediatrician's office. So your child can get a well visit there, your child can get routine immunizations there, you can receive a prescription there. They don't dispense drugs, but you can receive a prescription, get a strep test, whatever you would normally receive in a pediatrician's office. Plus, one of the foci of the community health centers, because we serve a population with multiple chronic, many of whom have multiple chronic conditions, diabetes, cardiovascular disease, obesity. There are many, many patients with multiple chronic conditions. There's an emphasis in the school-based health center in health education and counseling, particularly around asthma and pediatric obesity, and I know my fellow panelists will talk a little about their work in those areas as well. So I just have a couple more things to say. Am I running out of time?
Keep
No,
going.
I'm good? Okay.
I'll poke you when you're...
Okay, good. Okay, how about this? So, as I mentioned, collectively around the country, federally qualified health centers serve over 25 million Americans. But who are our patients? 1 out of 7 are uninsured. 1 out of 5 are low-income uninsured citizens or non-citizens. 1 of 7 are Medicaid beneficiaries. In New York State, we serve 1 of 10 Medicaid beneficiaries in the state. 1 of 3 of our patients live in poverty. 1 of 7 are rural. Close to 1 million are farm workers, and 1 million are homeless. So a lot of folks have asked us what is the impact of healthcare reform on the federally qualified health centers. You serve the uninsured, so there aren't any uninsured anymore, right? That's unfortunately not the case. And the health centers have been very actively engaged in enrolling patients in the exchange in New York State. New York State of Health is the name of our health insurance exchange. And indeed, the percentage of uninsured in our health centers in New York State has declined. Now stands at 22%, was 28% prior to the Affordable Care Act. But Our total patient population has increased dramatically from 1.3 million in 2008 to close to 2 million now. So our actual number of uninsured has increased over a 5-year period between 2008 and 2013. So it's still very much an issue in New York State and around the country, despite the expansion of insurance coverage. So I know that Laura Tiedge is going to talk about the work the Rye Y has done in, I think, pediatric obesity. Is that
Central
right?
obesity and diabetes prevention.
Yeah, a lot of the areas that we work in also, and in fact, many of our health centers around the state have been involved in a state-funded project on pediatric obesity, where we have been working with local Ys and grocery stores around nutrition and exercise education and programming in local communities. Just a couple of words about the Community Healthcare Association of New York State, which is the organization that I work for. Most states in the country have an entity called a Primary Care Association, and we are the Primary Care Association for New York State. We receive a relatively small federal grant to help cover some of our infrastructure, but the balance of that covers about 1/7 of our budget, and we are not a large organization. We're 35 people. The balance of our funding is 100% grant funded. So we are constantly on the make, and we actually have a grant from the New York Community Trust. We have many funders supporting our work in, that's not mine, yes?
Yeah, right.
That's not mine.
That's not mine.
I have oatmeal.
Oatmeal.
So the role of our organization, which the acronym is CHCANES, Community Healthcare Association of New York State, is to provide training and technical assistance to the health centers statewide, to provide support for operations, leadership development, workforce retention, which is a huge issue in many areas of the state. It's not easy recruiting physicians to work in the North Country. As well as we do a lot of advocacy work in Albany. We have an office in Albany, as a small office in Albany, as well as an office in New York City. We have programs, the programs that I'm responsible for are the Health Information Technology and Clinical Quality Improvement programs. We also have programs in planning for expansion. We run conferences and trainings. We have an emergency management program, a workforce program, a very robust policy program, and basically are there to support the health centers as they are constantly adapting to changes. Our environment is one that is just changing before our eyes with healthcare reform, both federally and in New York State. So that is the work that we do, and turn it over to my colleagues.
Perfect. Before our first Laura speaks, I thought it would be a good idea to wait until each of our panelists have spoken, and then if you have questions, hold them till the end.
So good morning, everybody. I'm Laura Rossi. I'm a senior program officer with the Westchester Community Foundation. The Community Foundation is a philanthropic organization. We are a nonprofit organization. We hold your community's endowment. We hold Westchester County's endowment and make grants from discretionary field of interest funds to nonprofits around the county. We also have donor-advised funds for folks' individual charitable giving, and we work closely with our donors to inform them about the issues in our communities, such as the disparities, even within one set of zip codes, as Lisa was talking about. We are an affiliate of the New York Community Trust, which Lisa mentioned, which is New York City's Community Foundation, one of the oldest foundations in the country that does a lot of grant making in New York City. And we have a sister organization in Long Island called the Long Island Community Foundation. So I have the good fortune as a program officer to work with the nonprofit community and to be out and about throughout the county learning about the issues. My program areas have been well, when I was hired, they were 3 areas. Now they're about 15 areas, but health is one of them. I also do work in community development, the environment, and also responding to special projects like disaster preparedness or emergency relief, or issues around veterans, issues around seniors, issues around the disabled, all the things that come up in a community, we learn about, and we try to use the funds that we have, which were set up by donors with their charitable interests, to be responsive to the needs in the community. So we have a lot of funds for children, and we bundle them up, and we try to make very strategic grants to address issues affecting children in the county, like access to higher education or health care. Our health fund was established, I believe, about 10 or 12 years ago. It was originally a freestanding foundation, the Westchester Health Foundation, and it was set up by a number of corporations in the county who were concerned about the uninsured and the underinsured for people living and working in Westchester County. That foundation came to us as the Westchester Health Fund, and has been the centerpiece of the work that we've done in health grants to nonprofit organizations. We've tried to be very strategic, and because it's not a lot of money. So where can we have an impact? And in all of our grant making, we try to get very local and to be very responsive, and to partner with great organizations like the Rye that are working in the community and have boots on the ground to really bring a community together around difficult issues and stay in it for the long haul. I wanted to just share with you that we also have a very robust environment grant-making portfolio and a community development grant-making portfolio. And I bring that up because when we make our health grants, we're looking also at our community development grants and our environment grants, and how we can knit the funds that we have together to have greater impact. So for instance, a number of years ago, folks at the New York Medical College came to us, and they wanted to start a pediatric environmental health program. There's a very well-known one down in the city that's run out of Mount Sinai, but there was nothing in Westchester and the Hudson Valley, and we provided seed funding. We used some of our environment money and some of our health money, and this is around information and education around pediatric environmental health issues. And they've done a lot of work around asthma. It comes up again and again, and so we learned it's the #1 cause of emergency room visits throughout the county, not just in, it spikes in certain areas, but throughout the county. They also do, so that's just one example of how we try to take a holistic view. Through our community development grants, we've worked with the Hispanic Resource Center, Larchmont Mamaroneck, on building the capacity of that agency to be responsive to the needs in the community, whether it was during the floods or whether it's the day-to-day case management and helping families as a whole, the children, the workers, the moms, all of that. So and I have information here, so I won't take up time, but I put together sort of a chart of the list of the grants we've done in your community, just to give you a sense and to assure you that we care deeply about the overall health of your community in lots of different ways. We've even done some work with the planning around the train station in the village of Mamaroneck, so that it could be more walkable, more livable. How do people move in and around? How do the folks in the low-income community have a say in the planning that's happening down at Village Hall, and how does that happen? So that the community is engaged and strengthened as a whole. So some years ago with the health grants, we started a faith-based health initiative because the Affordable Care Act was coming down the pike, and we were trying to figure out where can we make a difference. And what we found was looking at health disparities, and in the African American and Latino communities, chronic disease, diabetes, heart issues were the death rate. It was just unbelievable, the disparities that were happening. And we looked at what other foundations were doing and saw that, partnerships between places of worship and healthcare providers could be a really innovative way to help people start to think about their health in a holistic way and basically bring the program to where the people are. And so we had a 3-year initiative, faith-based health initiative around the county with some great projects that I can go on and on about, just churches revamping their menus to be more heart healthy, or running yoga programs or exercise programs, where people are in the church, bringing the doctors and the nurses and then behavioral health specialists into the community so that people could take a hold of their health with their peers in a comfortable setting. We have continued in that vein, not specifically around the faith-based, but again around chronic disease prevention and management. Like, we want to be addressing where the disparities are. And so we put our eligibility and our guidelines and our priorities out on our website, but we also go out and talk to folks. So we've worked with the Rye Y, as well as with Hispanic Resource Center, and speaking specifically in your community. We have also made a grant to Open Door over the years, many, but specifically last year around embedding behavioral health specialists during a visit so that they can run more efficiently, and because the behavioral health issue is another issue that keeps coming up to the fore. I mean, people call us and we're hearing about that, and that's across all ages. Behavioral health issues around children is another theme that keeps coming up, but also seniors. So sort of looking at all age groups and making grants that we feel can have, for the small amount, we feel can have the most impact in the delivery of services. And then I just will share with you one other grant that's kind of cool that you'll be hearing about hopefully soon. And that's a grant to an organization called Young Invincibles, which is whose mission is in the health. They do a lot of things, but in the health sector, and they're a national organization, but they've started here in Westchester, is to get young folks to enroll in the Affordable Care Act. You're nodding, perhaps you've heard about it, but they do a lot of education and information and enrollment. But our grant is also going to help them. They've developed a new smartphone app, because anybody under my age seems to have about like 25 apps on their phone. This is a healthcare app. And this is to help young people who sort of live and die by the phone, hopefully live a long life by the phone, to think about their health care, learn how to use health insurance. What does it mean now that I have health insurance? And learn how to live a healthy life. So hopefully you'll be hearing about this new mobile app, and it's specific to New York State. It also connects you to local providers. And what was very interesting was the group did focus groups with young people, and I went to one in Mount Vernon, and it was fascinating to hear these 20-something-year-olds talk about what they wanted in an app and how they were managing their own health care too, and what they want from their health care providers, and that mom is always the first line of defense, it seems, when you get sick. Very interesting so we like those kind of innovative programs that are listening to the community, understanding the needs, addressing disparities, honest that progress is slow. It takes time, and also cognizant of how a community can come together to address difficult issues. So I'll stop there, and it's a good lead-in for Laura's work.
Thank you, Laura and Lisa. And thank you, everybody, for having us for breakfast this morning. So, when we look at some of the chronic conditions that we're talking about here today, it can really sometimes feel incredibly overwhelming, because there is so much that is not going well in terms of our health as a nation. And sometimes some people I think will get a little overwhelmed to the point where they don't really know what to do. Like, how can I possibly take action? It's hard enough to take care of myself, let alone thinking about taking care of other people. And so what I wanted to focus my talk on is a little bit about what you can do, kind of boots on the ground. We all have a role to play in helping to keep our communities healthy and make them even healthier. And so taking this kind of from the framework of the why, Y, as I work at the Rye YMCA. Much of the work of the Y during the last 10 years has not only been focused in on the health of our membership, because clearly that's where our primary focus is, helping our members meet their health and wellness goals, but in the last 10 years, we've really focused our attention on what can the role of the Y be in improving the health outcomes of the community at large. Because we may have one small community in our building that represents the communities of Larchmont, Mamaroneck, Rye, Neck, Harrison, Portchester, but all of our members live in communities. And so we have felt very strongly that the role of the Y is really to go outside of our walls and take what we know and help coalesce communities to help improve outcomes for the entire community in large. So we've kind of done this in terms of looking at a framework for healthy living, and that framework looks at prevention in multiple ways. We first kind of think about primary prevention, and that's actually promoting well-being. All right, and those are like the simple nuts and bolts things that we do, whether it's somebody coming to the YMCA to use the facility, or it's the Y organizing an activity in a local community where basically people are taking actions to promote their overall well-being. All right, that's primary prevention. All right, let's stop it before it starts. And so that's one primary focus, and that focus can look different depending on the population that we're working with. So our second line of defense is really looking at trying to reduce risk. All right, so we're not going to be able to get everybody at that point where they haven't developed a chronic condition, but we can also help people who may be at risk for developing a chronic condition not develop that chronic condition. That might be something like our diabetes prevention program, or the Health Smart Behavior program, which really focuses in on behavioral changes that people can make to make their lives healthier. Because we all know, I think everybody in this room maybe at some point in your life have struggled with something related to your health, whether it was losing weight or gaining weight for some, or dealing with a chronic condition. People do struggle with that. We all know what that's like, and it's not an easy thing to change, all right? And it really takes help and support. And then finally, the Y has been focusing on what we kind of consider reclaiming health. And that's people who have developed chronic conditions and are really trying to manage those conditions, whether they're trying to manage diabetes, they're trying to manage heart disease, or they're trying to reclaim their health after a cancer diagnosis and trying to find a way to get back to physical activity and reclaim their health. So those have been like the three primary areas the Y has been working in. And when you look at it individually, it's very much programmatically focused. We like to look at it as an individual. We like to look at it also as the family unit. What can we do with the entire family? Because we do know that in order to improve the health of a child, we have to make sure the household the child is within is also a healthy household. And so we'll have specific programs that are educating parents on how to make healthier choices for their families in terms of food, reducing screen time, getting more physical activity, all of those things that really help that entire family unit become healthier. But there's also it's simpler to look at families and individuals. Where it gets a little bit more complicated is when you begin to expand that geographic location to organizations and supporting organizations that are looking to make their organizations healthier, as well as communities at large. So looking at organizations, some of the things that the Y works on, and Lisa was intimating a little bit about that, are helping organizations look at things like policies. So we might work with childcare providers or after-school providers and help them look at their healthy eating and physical activity policies. What policies do you have in place that are encouraging healthier food choices and physical activity? We might work with a church community or a corporation that's looking at wellness policies in their organization, and how can we structure things to encourage healthy eating, physical activity, looking at chronic conditions from a more proactive type of way. In Larchmont Mamaroneck, with our work, particularly with the school district, I want to give you some examples of what that might look like when you're working with an organization. One thing that's really going really well in this school district is you have a very active wellness committees in all the schools. And those wellness committees meet regularly, and the Y is also at the table with those committees to help address some of the issues that are experienced at the building level. Concerns parents might have about the school lunch program, how much recess children are getting or not getting, those things that are very much, within the context of that school community. So we support the school wellness committees, the school gardens throughout the school district have, many of them were started with support from the Y and continue to be maintained with our technical assistance and having garden workshops and other types of things that help those schools maintain their gardens. The Mamaroneck Avenue School has a spectacular garden, and we're very happy to be a part of making that a reality and continuing for it to continue to grow. The Y also supports the school recess programs in both Central and Mamaroneck Avenue schools. So we actually provide YMCA staff who go on the school grounds during recess and actually engage kids in physical activity so that the recess is a little bit more organized, and we're really trying to keep kids moving so that they're not kind of hanging out in the corner, not doing anything, really get them engaged in that recess time. And of course, we've also worked with the district in your Safe Routes to School initiatives, as well as supporting the activities at the Tiger's Den, and actually supported Teen Leaders program right at the Hispanic Resource Center. So when you look at things like primary and secondary prevention, and you say, well, what does that look like in an organization? What is the YMCA's role in something like that? It's helping those organizations see what they can do within the organization to improve health outcomes. All right, the Y might not necessarily be providing the service directly, but we're helping the organization to put that health lens on and figure out how they can do it. So the last element of it, I think, that our Y has been very much focused in on is then taking it beyond the organization and looking at it at the community level. And so our work in the last 8 years or more has been on supporting and sometimes organizing local community coalitions that are focused in on improving health outcomes in that community. So moving basically from the organization to the community at large. We've really tried to take this to be something that's very much looking at more of the policy, systems, and environmental approach to coalition. So, how can a coalition, deliver some really specific programs that have impact, whether it's a community health fair, which we helped this community organize last year. But then while you're working on those very specific health concerns, what are some of the changes that actually need to happen at the policy level? Are families able to access school playgrounds and community fields easily? Is there easy access to ways to recreate that are cost effective, if not free? Is the environment designed in such a way that it's easy for children to walk to school? Is it easy for people to commute to work using public transportation as opposed to their car? And then what are some of the systems that we might have to think of changing? And so for the Y, the role is to help the community come together and ask those questions. What are some of the key questions that we need to ask as a community? And then what the Y tries to do is kind of help coalesce and position and bring in resources, sometimes outside resources from funders like the Westchester Community Foundation, to address some of those specific things and help the community leverage resources to make a change in some of those things. One of our big successes in our early time in this work, when we had a large coalition called Activate America, and pioneering healthier communities, and that's kind of been renamed a bunch of different times. It's now called Healthier Sound Shore. One of the big successes that we had was very much an environmental success, and at the time it was referred to as the Boston Post Road Diet. And so we put the Boston Post Road on a diet in the stretch that runs through Rye, basically taking it from 4 lanes to 2 and putting sidewalks the entire length. And so there's also wide lanes for biking. And the idea there is, you're putting the post road on a diet, you're shrinking it, you're expanding ways for pedestrians to move as opposed to cars to move. And that was a coming together of local political figures, local government, the school district. It was really a coming together, and that's an example of how a community can really come together and say, we think that this will make a major impact on the health of our community. If more people can walk safely, more people can cycle safely, and we reduce traffic. It may not seem that way when you're going down the post road, but have traffic flow a little bit differently. So that, obviously it's a tremendous success that we're very proud of, but it takes a long time. That those are things that don't happen overnight. And most recently, the two coalitions that have evolved really over the last 4 years that we have been supporting directly is Healthier Portchester and Healthier Mamaroneck. Healthier Portchester is very much focused on reducing disparities in health that are experienced by the African American and Hispanic communities within Portchester. Specifically, really working on chronic disease prevention. What we have in place is a couple of different things, actually. One is a tremendous amount of support from the schools and through the school-based health centers and through Open Door, where we've really been able to kind of create this clinic to community bridge. The idea being that, health providers can't provide everything, and that there are local community organizations that can provide some of those things that a health provider might not be able to provide, like prevention programming. And so we will have people actually referred through Open Door to the diabetes prevention program. It's done all through electronic medical records. We've really kind of put a system in place of flagging people with pre-diabetes. Most doctors do not diagnose pre-diabetes. The vast majority, the photo that we use when we describe the chronic condition that we have coming up is that of an iceberg. And the tip of the iceberg, what is apparent is everybody who has type 2 diabetes, and below the iceberg is everybody with pre-diabetes. It's an extraordinary number, like 65 million people, and growing. And so very much our focus here has been how do we identify people who are pre-diabetic, and then how do we get them involved in actually going to a program that can help reduce the chances that they'll actually move into type 2 diabetes. We've also been focused in on mobilizing the faith community in Portchester. They have a very active faith community, very much connected. There is a lot to be said about the power of the pulpit in creating a sense of urgency among a congregation around chronic health conditions, and giving them the resources that they need to actually provide services and programs on the church site. And this past year, a major focus of Healthier Portchester has been increasing access to fresh and affordable food. So one project that we're kind of in the works about right now is the Portchester Housing Authority has provided us property in Midland Court, which is one of the public housing communities in Portchester. They've given us a very large plot of land, and we're actively seeking funding to plant a community garden in this space. And the garden would serve families in Midland Court as well as Purdy and Traverse. The properties on Purdy and Traverse. And right now we actually did home visits over the holidays with like door to door, knocking on the doors. And we have 40 people representing, I think it's about 25 family units who already expressed an interest in gardening. And it was actually really cool. I did not go on any of the visits, but one of my fellow staff members talked about one in particular. It was a household of, mother, kids, and grandma just went on and on about all the gardening she did when she lived in the South, and how, she would love to get back into the soil, but when you're living in public housing, Where's that soil going to be? So so that when we look at that, that's one approach. But the other thing that we want to do with that is we actually want to have a conversation with the community about that. Like, why do people, we have a Whole Foods and we have a Stop and Shop and we have bodegas. Of course, this is not a food desert. Portchester is not a food desert. It doesn't mean that people don't have they still can't access fresh and affordable food. And so there's a pathmark directly across the street from Midland Court. It's probably one of the older pathmarks around. It hasn't been renovated in quite some time. Is there something we can do with the store owners? In terms of how they lay out their stores to encourage healthier choices and how they price things. So that would be like looking at that policy systems approach, right? So while we're trying to get this garden established, the idea is you also look at the bigger picture issues. And so this August, when they have Unity Day, which is actually held within the public housing community, and people from all over the United States who used to live in public housing in Portchester come back annually for this Unity Day celebration. And at Unity Day this year, we are going to be screening the film Soul Food Junkies, and having a community conversation about how can we take traditional foods and make them healthier and still honor our traditions, but take care of ourselves in better ways. So I wanted to use that to illustrate how you, as an organization, you can kind of come in and do something specific, but then address the really the larger issues of why the problem is the problem in the first place. Because if you don't fix the problem, you continue to have, and we're just keep putting Band-Aids on it. So we kind of want to have that dual approach. In Mamaroneck, we've also been focused on reducing health disparities in health in the African American Hispanic communities. But also identifying other health-related risks that are impacting the community, because this Larchmont Mamaroneck School District is very diverse. There are issues around chronic disease, lack of access to health care, so many of the things that Lisa very beautifully illustrated. And then there are other issues related to mental health, substance abuse, service for older adults. In this community, Rye is experiencing the same thing. An increase in the aging population, and how do we continue to allow people to age in place and have the support that they need to do so, and then also create kind of this network where older Americans in our communities feel safe and supported. So some of the things that we've been working on. Also chronic disease prevention program, diabetes prevention program, and so on, using community health workers to kind of help bridge people to services, getting them into programs, access to health screenings. So last year we had it was called the Access to Care Health Fair. It was held at Mamaroneck Avenue School. This year we'll be having it again on June 6th. It's going to be at St. Thomas Church, and really just providing basic health screenings. Okay, so people who do not access regular prevention care, do not go to a doctor, and there are a lot of them in this community, as you illustrated, Lisa, can at least go and get screenings, the key screenings, diabetes screenings, blood pressure screenings, some key cancer screenings that they would otherwise not seek. All right, we're talking about a population that if they're going to seek care, it's because they're sick. They're not going to see preventative care. And so, and our feeling is if we can identify, which we did, the first health fair, we had 3 positive breast exams of all the women that we screened that day, and then the follow-up care was provided by Open Door. But if we identified and possibly prevented the death of somebody, all right, it was a success. It was a success. So things that we might take for granted, basic preventative health screening. Most people who Lisa was talking about in her statistics do not access that. So one thing that so on June 6th, St. Thomas will be providing another health fair so that people can get those health screenings in absence of access to regular health care. And then we want to see where the community wants to take it. Every year we revisit our priorities in each of the communities that we serve. As I said, Portchester really wanted to focus on fresh and affordable food this year. We have a Healthier Mamaroneck meeting later on today, as a matter of fact, and that's part of that conversation. What other health concerns are there in this community that we might want to address for the remainder of this year and into the future? So that's kind of what I wanted to talk about, and I wanted to kind of leave the message that, you know, all of you here and all of your friends and neighbors, you know, all have a role to play in not only taking care of your own health, but in creating a community that's where, you know, where the healthy choice is the easy choice, right? I mean, the healthy choice should be the easy choice. It shouldn't be something that you struggle to make healthy choices. And so, you know, I invite all of you to work with Healthier Mamaroneck and all the community, the beautiful, wonderful community-based organizations that you have already in place here, to make healthy living easier for everyone in Larchmont Mamaroneck.
So much.
I'd like to kick off the questions. In talking to a lot of people about this whole subject, in doing some research about what our program should be, a topic that came up very often from a number of folks is the issue of teens, and not only teens but even younger students, and stress both in the school and at home. Any of you like to comment on that? And are there any initiatives in particular addressing that?
I can speak to it. If I project, can everybody hear me? No. Okay. Okay.
It's for the recording.
Okay. Not specifically in this community, although when we had the call, it was very interesting to hear that it's coming up here as well. We've done some grant making to address substance, because we have a fund to address substance abuse and that kind of issue. And so there are organizations that embed counselors in the school districts, middle school and high school, around the troubled child, the child who's dealing with substance abuse. And one thing that was very interesting to learn is often it's a family system issue. Mom or dad is drinking, or there are issues there, so sort of unpacking what's going on at home as well. But the other thing that we learned in one community is that the child who is not doing well and got sent to the principal and the guidance counselor and then to this particular counselor was missing school and not coming in because dad needed him to go work. So in the undocumented community, there are huge debts related to getting here. And teenage kids or mom needs you to go help clean a house. It was a real eye-opener for me that sometimes these issues are far more complex. And there is the depression, there is the behavioral issues around all the stressors that are happening in a child's life. It's not just in that community. We see it in, you know, the wealthier white communities as well. There's substance abuse. There are stressors. There are all kinds of challenges. And I will say that all of the federally qualified healthcare centers and the nonprofit organizations that are, it's sort of a bit of a patchwork, and that's related to policy issues around how behavioral health services are reimbursed. So it starts to get complicated fairly quickly, so that somebody receives, you know, XYZ diagnosis and the agency will only get reimbursed for 3 visits, when really what the person needs, child, adult, is much longer intervention. So I don't know if that's just a tip of the, maybe you have more information on that
Just
piece of it.
in terms of sort of a policy perspective, one of the sort of movements now in New York State is to improve integration of behavioral health care with primary care, to really improve screenings when you have a patient, including a child or adolescent, in for primary care, to do a screening for depression or other behavioral health conditions, because it is extremely difficult for most people to navigate the behavioral health system and find a trusted provider of care. So actually New York State has a very large reform initiative underway right now that's really trying to change the way care is delivered and paid, and to incentivize more efficient care, better care transitions, lower hospitalizations, lower use of EDs, emergency departments. And a big focus of that initiative is to improve the integration of behavioral health services and primary care services, and to improve integration of healthcare providers with other community providers like the Y, or the state runs or funds a network of mental health centers that are really focused on behavioral health conditions, but they aren't always well integrated with medical care. So I think, there's still a stigma attached to obtaining behavioral health services, and one of the models that our health centers are beginning to implement, and I think one of the Lauras mentioned integration of behavioral health at Open Door, is to really embed a behavioral health provider, not necessarily a psychiatrist, because honestly, we can't afford a lot of psychiatrists, but licensed social workers, psychiatric nurse practitioners, to embed such a person with a medical care team, so that handoffs to behavioral health providers they're called warm handoffs, so that the patient is really accompanied through the care system, and the behavioral health provider isn't isolated in a wing called the crazy wing, but that the patient doesn't experience a stigma in going to actually receive that care.
Part of the team.
Yeah.
Could you explain the difference between the school-based health center and a community health center? Someone?
Sure. You want to start?
No.
Okay, I'll start. Okay, I'll start.
Oh, yeah.
Oh, okay. Here we go. Okay.
The question is, what's the difference between a community-based health center and a school-based health center? And I guess what role each of them plays?
Sure.
You're up.
Okay. So, community-based health center is for the community, basically. So children, adults. It is open, 12 months a year, often 12 or more hours a day, often 6 or 7 days a week. And is basically a community resource. But folks have to, if you want to take your child to the community health center, folks have to take time off from work and take children out of school. So the idea of a school-based health center is to really try to keep children in school and parents at work, and to address issues which may not necessarily require taking a child out of school. Although if those are detected, of course, the parents are called and requested to come pick up a child. The school-based health center is for generally, not always, but the one that is contemplated here in Mamaroneck is exclusively for the children in that school, which really differentiates it from a community-based health center, which is open to anyone in the community or in a neighboring community. A lot of our residents have been using the Open Door in Portchester because they have not had a comparable facility here. I think the other distinguishing feature is that generally a school-based health center has a single clinical staff person, whereas a community health center will have a roster of clinicians, which may include dentists, ophthalmologists, endocrinologists, as well as the primary care providers. So obviously for a child needing more intensive care, there would be a referral made to another provider in the community, whether it's at a community health center or elsewhere.
Another question?
There's a lady over here.
Here.
My question is anything being done for
there a doctor in the house?
With intergenerational programs, I mean, there's been a lot of statistics in terms of helping both populations. And
Did you all hear that? Is there anything being done for in terms of programs for intergenerational situations?
To that. Because at the foundation, we love intergenerational programs because it helps everybody. There are some promising programs. There's a program up in Mount Kisco. I can speak to what I know. I think there are plenty going on, and I don't know whether the SPIES and the Aging in Place networks have moved into doing this, but they certainly have good examples to learn from. So there's a partnership up in Mount Kisco called between the Mount Kisco Child Care Center and My Second Home, and it's in the same building. They're two separate entities, but they're connected and they have activities throughout the day. And it's wonderful because a lot of the little ones have grandparents, and a lot of the folks, the seniors who go to My Second Home have some dementia issues, et cetera. And we funded some research to see, how this type of environment helps people. And it's stimulation, it's the human contact, it's the beauty of not being isolated for both. And a lot of those relationships have continued. So that model is now expanded to White Plains. I'm not sure when it's starting. I think soon. But gosh, we could use them all around the county because it meets so many needs. We see intergenerational programming in lots of different agencies around the county, and there's just a wonderful there's a hunger for it. Because we have an aging population. Our 85 and up population is one of our larger growing populations. And folks want to age in place, and they don't want to be sitting around. They want to be doing things. So, and of course, a lot of the seniors who are out and about are doing a lot of volunteering, and there's all that. But in terms of structured programs, My Second Home is a great example to look at.
There's one example I'm aware of at Open Door and other health centers called Reach Out and Read. And the health centers solicit donations of books, gently used books. And then volunteers come to read to kids in the waiting room. And then the kids are allowed to take the books home. And I think there are a lot of seniors involved in those programs.
Sure. Yeah.
Oh, sorry.
There was a fairly immediate and rather local negative reaction to the initial thoughts of having the school-based program at Mamaroneck Avenue School. And I'm wondering how much of that kind of reaction is usual with such a proposal, and to what degree is it justified?
The question is whether the strong reaction to the proposal for the school-based health center is typical, and has that been experienced in other areas?
So we have a strategy for responding. So I think it's not an unusual response. But I think it's not exclusive to school-based health centers. I think whenever you're trying to embed a social service in a community, there can be pushback. We have a residence in Larchmont for people recovering from mental illness, maybe even more than one. And there was enormous opposition to that. People are afraid. And I know that there has been opposition in other communities that Open Door has eventually successfully established school-based health centers in. So I don't think there's anything to fear, but I think there is a lot of fear, and so I think whatever we can do to lessen that fear, will have a positive impact for the community.
How do you determine the need for a school-based program versus a community-based program? Because it sounds like the community-based program will offer more services for more people, as opposed to the school-based, which is just going to treat the kids who go to that school.
Do you want to just talk about the first question first?
Well, in a way, I can speak to both questions. So the second question was, if you've got the community-based center, where's the need, or why would you need the school-based center? So in trying to understand this issue in Mamaroneck, I spoke to a number of folks, including the former principal at the school in Portchester, to ask, how did this come about? Was there opposition in the community? And why do you need both, right? Because they have Open Door and they have the school-based center in Portchester. And the answer was yes, there was concern, fear, trepidation. What is this? How does it look? How does it play out? What about the school nurse? What are the union issues? And it just took time to work that out through, and I think involvement of the community around that. I mean, the person I spoke with, Eileen Santiago, who's become a national spokesperson on the value of school-based clinics, said, the nurses were like, well, what about us? No, it's a partnership. We work alongside that, and carefully crafting who does what, like the warm handoff. And it's not an impossible thing, and there are good examples for how to do that. And it actually maximizes the impact that all personnel are having. And so I also asked her the question about, well, why do you need both? The availability of services right in the school was critical, both for school retention and I think Lisa spoke to this a little earlier, and I could relate to this as a working parent, and just the logistics of getting when the kid is sick and you gotta leave work and you gotta go get the child and take them and get the appointment, it's tough. So there's just an ease and availability and access to services at the school, and there's also a strengthening of the school environment as a whole for the employees of the school as well, so that everybody is, to parrot what you're saying, everybody's thinking about the health of the school in general by having these healthcare services embedded in the system. There's the school-based and the community-based in Portchester, from what I can see, seem to just strengthen each other. The needs are so great. There's plenty of business to go around. And the efficiencies are increased by being able to help that child when the child is in school, dealing with that right then and there. And the other thing is teachers pick up on things that a well visit isn't going to happen. So teachers are often sort of the front line in what's going on with the child in terms of physical health and behavioral health. That we see in all the schools.
And to just add on that, having now worked with Open Door in both the federally qualified health center and the school-based health centers, in talking to school personnel and parents and kids, it's that sense that child is really being cared for, and that the teachers if they do see something, it's easier to help that child along because the service is in place. And talking about impact, which we were talking about earlier, right? So if we have a problem, we're trying to have impact on it, how are we going to do that? And where 70% of the children receive their health care at their school-based health center, over the course of the last 4+ years, Open Door has been able to have incredible impact on their student asthma rates to one of the lowest in the state, where it was one of the higher. But that's because there was a very focused approach to monitoring student health. And so when you're able to do that and kind of really put a laser on there, you can provide services not just through the school-based health center, but bringing in outside agencies and so on to really make a difference. And I think in the end, that's what we're really trying to do, is impact that health. And school performance goes along with that.
Which is key. Yeah.
And one collateral benefit that I think is really fantastic is that the kids actually form very close relationships with the providers in the schools. And these providers are role models, and this really sets the kids up for a lifetime of engagement in their own care, and a lack of fear about healthcare providers, and just really sets them up for a healthy lifestyle.
Sure. Does that just trigger something? I'm sorry. And a real example of that, of some of that residual impact, Open Door through the school-based health centers has a future healthcare leaders program. And, these are high school kids who, throughout their career, were served through the school-based health centers that are now entertaining careers in the healthcare field, because they had that exposure, and was such a positive exposure and a professional exposure that they're looking at professional careers now as they're getting ready to graduate high school. I mean, like, bonus. It's total bonus.
This is the thing that I love so much about Open Door is they're like endlessly innovative, and really they're one of the leaders of innovation in the federally qualified health centers statewide. I'm sorry, can't hear you. Oh yes, they do. Oh yes.
Did you hear that Open Door also works with AmeriCorps? Yes.
I'd just like to speak as a former school nurse. I think the clinics would be a fantastic idea. I worked at Westchester Day School as their nurse, and I worked at the Hallam School as their nurse. And completely different types of schools. I worked in 2 local schools, and I highly recommend that we do establish these healthcare centers, because you get children. I had a child come in with a little bandage around his wrist. He had a broken wrist. I mean, I had children that unbelievable, and if they could have gotten the care that they needed, I'm sure a lot of them would not have ended up on the streets and probably dead. And with what's going on in the community, with the heroin increase and everything that's going on, we've got to do something to help our children.
Thank you. Absolutely.
The gentleman mentioned fear, right? And I wanted to speak to that, probably because I'm a philosophy major. I just want to commend the group for inviting us to have the conversation, because I think we saw it with Hispanic Resource Center. We've seen it all around the county. So from the foundation's perspective, it doesn't happen overnight. And I think people need to be able to articulate their fears and concerns, or what am I not getting? Like I said, why do you need both? I don't understand. And to just air the questions and concerns. Air the questions and concerns, but also acknowledge the disparities. Because one thing that we struggle with is people just are shocked to learn what's going on. And a lot of times, this being suburbia as opposed to the city, poverty and need and homelessness and hunger and drug abuse, all that is kind of under the surface. Whereas, and we're always speaking with our colleagues in the city about, a lot of our work is raising consciousness and also raising hope. Because we have an image of ourselves as Westchester. I'm proud to be in Westchester. But let's acknowledge there are communities that are in transition, there are populations that are changing, and it's good. We just have a lot of work to do. So I just wanted to speak to that, because I think this kind of forum is where it's going to happen. It's just about getting together and talking. So.
Also, regarding the specifics of the community-based health center in that Open Door would like to open in Mamaroneck, that they would be subleasing space through Westchester County Medical Center. And Westchester County Medical Center, I believe, has just recently executed that lease. The opening of a center, of a community-based health center in that space is, I would say, at least 2 years away, possibly longer, because there are the New York State regulations, the federal regulations, the renovation, and the negotiations with Westchester County Medical Center. So I think it's not a slam dunk overnight thing. As Laura said, there is need in the school.
I was joking about going right through lunch, but it seems like we probably could. Unfortunately, we've run out of time. I'd like to thank our panelists for what has been a fascinating and really informed presentation. I think we should take this on the road. What do you think? Thank you all. This is great.